Tonight on Punchline, we are tracking COVID-19 as it spreads across the country, and we will be examining the virus itself, its impact on our people, our economy, and our politics. So we want to start you off tonight with Dr. Mark Nanyingi. He is the country ambassador for the Royal Society of Tropical Medicine and Hygiene in Kenya. He is also an infectious diseases epidemiologist, and he is back on Punchline. So welcome to you, Daktari. The last time that we spoke, that was 3 months ago. It was just as the pandemic had hit Kenya. And at the time, you seemed to suggest that Kenya was handling COVID-19 fairly well, but not well enough. 3 months on, how would you rate the Kenya government's response to COVID now, and particularly since we have reopened the country?
Thank you very much, Anne, once again for coming in to discuss about the issues of COVID-19 in Kenya. Indeed, we were very optimistic 3 months back. The government was actually putting in all efforts to combat the spread of the infections. But the main strategy that has been employed by the government has been lockdowns. And lockdowns in themselves, they are not antidotes, actually, or they're not supposed to cure the disease. What we anticipated was that the lockdowns actually provide adequate time to put into place all the preparedness and response mechanisms that to anticipate if there's any surge. And this is essentially the principle of flattening the curve. By reducing the number of sick people, or by reducing the number of infections, and then the government ought to have actually maintained the standard protocol of test, trace, and actually isolate, and being able actually also to treat sick people. But now what we have seen, and the biggest question is, have we lowered the numbers? Definitely, the answer is no. Is our health capacity and the hospitalization actually able to accommodate the numbers that are coming up? The answer definitely is no. Are we reducing the number of deaths? No. Are we testing more? Are we able actually to ramp up the targeted test testing so that we can detect more people in the community, especially the asymptomatics? I think we haven't done much on that. And then our key issue is actually on the healthcare workers in terms of their capacity and actually also preventing infections in healthcare workers. So I would be very fair, indeed, to say that we haven't seen an evidence actually in the downward trajectory on the number of cases. You need about 2 weeks to have an incidence documented that you do not have any cases, actually, or any deaths. So far, we are seeing that the cases are spiking, and we will give the government probably maybe a 50% mark in the efforts that they have done, and quite commendable given the challenges that we have in terms of resources.
Right, hold that thought there, Daktari, because it sounds like you're saying it wasn't the right thing to do in terms of reopening. You've talked about that 2-week period, and I believe you've written on the same. But since you did mention healthcare workers and their ability to be able to stop infections, of course you're aware of reports of a COVID-19 outbreak in health facilities and affecting healthcare workers in particular, and that has been very worrying. So what does that mean in terms of our health protocols on the front line?
I mean, when we are seeing the infection actually rising in terms of the healthcare workers, and then this should be a telltale signs of a steady intensification of community transmission. But then, on the flip side, it shows that the infection and prevention controls, the IPC controls that are supposed to be in place in terms of having proper PPEs, and not just PPEs, but training of the healthcare workers in terms of handling highly pathogenic diseases like COVID-19. Probably this has not been done, and therefore there's a need for capacity building in terms of the human capacity training of the healthcare workers, the frontline healthcare workers, to understand that this is a really highly pathogenic disease, and the need actually to use the proper protocols laid down. So our infection prevention control protocols need to be adhered to. And for now, I think they are not doing much. And this is also due to the PPEs.
Right, right. So again, sounds like we're falling short of the mark. Now, there are also reports that the government has abandoned testing and is now redirecting resources towards caring for the sick. Would you agree with that move, given our very limited resources? And is it not the case that governments appear around the world to have silently concluded that herd immunity is the answer?
I wouldn't authoritatively comment and say the government has abandoned that. Of course, I've read it in the media. I understand what the Kenya Medical Research Institute, which is mandated to do the testing, requested was not receiving people who walk in and want actually to give their own samples, but probably to use a seamless referral system that will be able actually to track these people where they're coming from, or probably being referred by lower health facilities. So I think the testing is still going on. It might be slightly of the lower scale, but I don't think it's completely abandoned. Now, on herd immunity is not an approach or a strategy, but an outcome of a disease process. So it might be actually unethical to advocate for intentional allowing the disease to take its course. This means that you'll allow people actually to get more sick, which is be a calamity, to see how many people can be heal on their own or actually adapt to the disease. And most infectious diseases, actually, they need something we call the herd immunity threshold. And this is about 60%. It means that about 60% of the entire population needs to be exposed to the disease so that they develop immunity and they can confer to the other 40%. But this can only be achieved in most cases by a vaccination strategy, whereby you have a vaccine that is targeting actually to immunize a number of people. Some diseases like measles, you might have even up to 95% vaccine to succeed. So herd immunity should not be discussed at all at this point, because there's so many unknowns about how this disease is being actually sustained in the population. Right. And therefore, our own government will not really go for that strategy.
Okay, you would hope that they do not. Okay, but we'll return to that question of the unknowns, at least in the scientific community. But the administration also appears to have taken the view that the only way to stop the disease is to change behavior. And we had things to the effect of that last week when we spoke to the President's Chief of Staff. And even when you listen to the CS, Mutahi Kagwe, it appears that he also agrees that Kenyans seem to have refused to change their behavior. So are everyday Kenyans the weak link in Kenya's response to COVID-19?
Yes, I will definitely say yes, because we as the citizens, we need actually to support the government efforts and not constantly, being criticizing or actually tearing the government apart in the efforts that they're doing. Any disease actually there's an action plan that guides the COVID-19 preparedness and response. And these, they are laid down risk communication and community engagement processes that have been developed by the WHO, which requires a behavioral communication change, whereby there's a risk communication, and there's a need, actually, you find that the responders and actually the national and the county health authorities have tailored messages that they have been spreading through the community or local partners to protect individuals and families, and probably at the same time to have very good response to this. But for this to succeed, there has to be utmost compliance from the general public. So the general public doesn't need to be coerced actually to do this. It just needs to collaborate with the security forces to follow the laid down public health guidelines. For example, if the curfew has to end at 9, it has to end at 9. If there's an issue of restricted movement to fly out of the country, all these things have to be followed. So behavioral change is very key actually for the overall success of combating any disease that spreads between one human to another human.
Now, given the numbers that we are seeing in terms of infections, can we at this point return to lockdowns as a solution, or has the horse already bolted, in your opinion?
Lockdowns are only feasible if we are going actually to implement the issues that I talked above when we started this discussion. So unless we have a robust public health system that actually has empowered the healthcare workers and also prepared actually the lower hospitals in terms of them having proper capacity to hospitalize and treat severe cases. I think putting on a lockdown will not really make any sense because we will be sort of now incubating the disease more. We'll be actually be trying to create a reset button. And this will probably can even worsen when you talk about opening up international travel while you're locking down the entire population that are within the country. Because what we have now is sustained transmission, and we need to disrupt that chain of transmission. The other way would be to have lockdowns that are case by case, looking at areas and actually being able to restrict movement between those areas. So for now, I wouldn't really advocate for lockdowns unless we are saying that within the last 2 weeks, we have really done extremely well to put all these things into place.
Dr. we just have under 2 minutes, so I'll sort of just bundle all my remaining questions together and hopefully you'll be able to give us an answer. As we conclude, you talked about the many unknowns of COVID-19 and the government has been clear that part of the reopening is also just given the fact that there wasn't really consensus by the scientific community on what was the right thing to do and livelihoods had to be saved alongside lives. So I'll start by asking you, what are the major unknowns that scientists still do not know? We also understand that the University of Nairobi had plans to conduct clinical trials for possible COVID-19 therapies. Where are we with that? And very finally, what can the president do now to protect lives?
I think COVID-19 is a new disease, as all of us know, and many people are still learning globally, given the kind of rapid nature of the disease. But what is actually unknown is the immunity profile of this disease. We don't really know how long once somebody exposed and probably they're able to produce neutralizing antibodies, how long these antibodies are able actually to last and confer immunity to these people. And this is the basis of actually vaccine development, whereby we need to know the type of cells that are being produced, whether they are T cells or B cells that will be actually to combat the disease. So that is still under investigation. Another thing that is not also known is the damage that actually the disease causes to the respiratory tract, specifically the lungs. We are seeing actually people who can recover, but they can have long-term damage to their lungs. So the burden of respiratory infections might actually increase over some time because of what impacts that especially the lungs are having. But also we are aware that there are a lot of extrapulmonary effects of the disease. This means that there are other multi-systems that are being attacked just beyond the lungs. We have seen some people talking about reproductive tracts or sometimes even the mental status of some of these patients, and sometimes even visibility. So some of those things are still under study, and as the time evolves and more research is done, probably many people will be able to understand this. In terms of the clinical therapies and the clinical trials, I think this is a very welcome idea from all local institutions, of course, in collaboration with other global institutions. We need to have these strides in terms of creating autonomy in terms of our own research so that we have local solutions. So University of Nairobi, the Wellcome Trust, and KEMRI and other institutions are actually geared up to actually do randomized control clinical trials in terms of vaccine development and other therapies. And this will also go hand in hand with all the other global efforts that are ongoing.
All right. Finally, anything that you think the president can do now? I know you had outlined, various irreducible minimums of your own in terms of the reopening, but like we said, the horse has already bolted. What can still be done to protect life and livelihoods?
So there are people who are vulnerable in the community. These are people that, specific attention has to be paid to. These would be people with underlying illnesses for a certain age group, or there will be people who are poor, and probably their hygiene issues might not be really catered for. The specific attention actually has to be paid to this category of people in terms of shielding populations that are more vulnerable to this. But on the more critical part is that we cannot abandon testing. Testing is the only way that can explain to us or can give us a picture on how far the disease has spread. So if we are talking about either the government or any other entity actually thinking about abandoning the test and maybe letting the disease spread, I think that will be a really unfortunate situation that has been taken by either the government or any other agencies that are putting on to this. We also need for the government actually to recruit more healthcare workers. And apart from recruiting more frontline healthcare workers, there is a need actually for capacity building in terms of infection and prevention control mechanisms, in terms of lab diagnostics, where we need to ramp up our testing capacity and develop actually local tailor-made solutions that can actually conduct large-scale epidemiological surveys for antibody testing. And then finally, I think the issue of PPEs cannot be underestimated. And PPEs is on the healthcare workers and also on us as other people actually who are out there who are actually exposed to this. For example, we need, if I was the president, we need to go with a national masking mandate. National masking mandate actually makes it an offense if you're found out there and you're not putting on a mask, because we have been shown that this disease, there's a potential for airborne transmission. And therefore, if everybody puts on a mask outdoors, this will really minimize all these other issues. And social distancing has to continue to be maintained, where schools and the other institutions, the way they are closed, places of entertainment and restaurants. And the biggest challenge is actually the matatu industry. Then how do you enforce the 50% carrying capacity for the long plying buses and also the ones which actually ply within? So all those mechanisms need to be put in place so that we have a tight and a kind of a robust, targeted way of actually controlling this disease. And discipline has to be in all the people, while all the time we have to follow the science. Thank you very much.
Thank you very much, Dr. Mark Nanyingi, speaking to us. After the break, we continue our conversation with other experts. We're speaking to Bill Okero, the impact of COVID-19 on the economy, and a little later, its impact on politics as well, with Professor Mutahi Ngunyi. Stay with us.